Dr. Ramalingam, can you tell us about the heat shock 90 protein strategy in adenocarcinoma of the lung?
Sure. So if you look at heat shock protein 90s and what they do in the cell, they help activate a number of proteins. When the proteins are synthesized, when they come out, they are not in a structurally active conformation. So they now have to associate themselves with HSP90, and then that becomes activated, and then they can do what they're supposed to do. By blocking HSP90, you have the ability to affect more than 200 known client proteins and inhibit them from being able to do what they're supposed to do. And among these 200 proteins are critical oncoproteins like EGFR, ALK, HER2/neu, and so forth. So by blocking HSP90, you have the opportunity to, at a broad level, inhibit a number of oncoproteins that the cancer cells depend on. And that's why this has been considered a novel strategy to treat cancer for over 2 decades now. But now we're beginning to see drugs that actually can do that, and ganetespib is more prominent among them.
In the Galaxy 1 and now in the Galaxy 2 trials, you're looking at an adenocarcinoma population. Why not other lung cancer types, or will you look at those in the future?
What we have seen is lung adenocarcinomas have a distinct biology compared to lung squamous cell carcinoma. In the early phases of the program, we felt that the squamous cell or non-adeno patient population did not see the same kind of benefit we would like to see. So our program is now focused, at least the Galaxy program is focused entirely on the adenocarcinoma patients.
Do you think that in the future you might be combining a heat shock HPS90 inhibitor with another agent possibly to go after those other cancers?
Right. The positive observations of Galaxy 1 and hopefully Galaxy 2 opens a broad array of possibilities, combining this with other chemotherapy drugs, combining this with other targeted drugs, testing this in other cancers. So that's the exciting implications that come out of you see the kind of results that we've seen so far.
Thank you.